I'm going to ask Miss Stephanie to come to the fore, please, and thank you.
Thank you. A 024.113, 024.410, Z3A.40, 024.410, 024.913, C 024.913, D 024.410, and Z38.40. A pregnant woman in her 40th week has gestational diabetes, which is controlled by her diet. What ICD-10-CM codes are reported? Your time begins now, 2.5 minutes.
Okay, I think you all outstanding. Outstanding. All right, let's go ahead and highlight our keywords. All right, so we have 40 weeks pregnant patient, gestational diabetes, and it is controlled. Her gestational diabetes is controlled by her diet. And I'm writing it 40 weeks pregnant, gestational diabetes, controlled by diet. Now, is there a guideline that's going to help me eliminate some things on site? Can anybody eliminate some on site? Go ahead, type in the chat if you were able to eliminate anything on site. Outstanding. Outstanding. Somebody is doing it. Outstanding. Yes. This is gestational diabetes. It could be one or the other. Did the gestation cause the diabetes, or did the diabetes pre-exist? Was the diabetes there first? Okay. All right. Yes. So when you have gestational diabetes, it tells you sequence first from 024.4 subcategory. Yeah, we can eliminate A and C. A is coding for pre-existing diabetes first, and C Well, that 9 is telling me that it wasn't specified if it was pre-existing or gestational. Just saying. And don't forget, when it is 4, the gestation caused the pregnancy. Maybe that resonates for some people, and maybe it doesn't. But let's go ahead and do our due diligence and let's look up these codes. So O24.1, as I've said before, is pre-existing type 2 diabetes. There is no mention that this was pre-existing, right? It's gestational. So O24.1 gotta go. Next, O24.9. This is unspecified diabetes mellitus in pregnancy. They didn't specify. That's what this means. This means that the doctor didn't specify if it was gestational or pre-existing. So the doctor did say, hey, this is gestational. So O24.9 is incorrect. Are you all with me? When somebody also points out that A is coding for both pre-existing and gestational diabetes, that is not clinically correct, and you're probably never going to see that. I'm not gonna, maybe I shouldn't say never, because there are, everyone's different, right? Yeah, but you typically should not code for both. So that leaves us with B and D. B and D both have O24.410. So we know that's correct. On site, we know this is the code for gestational diabetes. Oh my goodness, but B is incorrect also because it's coding for gestational diabetes and unspecified diabetes. And just like A, having both, you can't have unspecified and specified in the same encounter. So B is incorrect. And the answer is D. O24.10, gestational diabetes in gestational diabetes mellitus in pregnancy, diet controlled. That is how specific this code is. And our second code is our weeks gestation code. Z3A.4, weeks gestation of pregnancy, 40 weeks or greater. Yeah, so this patient is 40 weeks, and that is our code Z3A.40. And if you said D, outstanding, but if you learned something, I hope you did, that's priceless. And I see people self-correcting. That is phenomenal. Definitely self-correct. If you see that you made a mistake, go ahead and self-correct. And if you want to let us know, that's awesome. I love when I see that. All right, we got another scenario. Yeah, these are flip exercises. So these are probably in an old or current MCG manual. Okay, Miss Stephanie, please and thank you.
A Z34.01, B O09.511, Z3A.13, C O09.521, Z3A.13, D O09.511, Z3401, Z3A.13. A 36-year-old woman presents to the obstetrician with her first pregnancy. She is 13 weeks along in her pregnancy. Called her 2.5 minutes.
Thank you. I'm not going to give you 2.5 minutes for this one. You all, we just reviewed this one, so I want to see what you can do with this. Somebody is just answering in record time. I just want to let you know I see you. Outstanding. And you know your guidelines. I do. I see you. Outstanding. Okay, I did give you more time. And I just wanted to, for those of you that are answering rapidly, definitely share why and how you're able to answer rapidly for your peers. And if you get an opportunity to put it in the chat, I will definitely share it with your peers. I'm guessing I know, but let me know. All right, so the key words, we have a 36-year-old woman, right? She's high risk. First, pregnancy. She is 13 weeks along in her pregnancy. Okay, so, all right. So here is the inventory. Here is the guideline. We just reviewed this guideline, C15B2, and it says you got to sequence your supervision of high-risk pregnancy first, and that is what we're going to do. So we are also going to eliminate A because that is not a high-risk pregnancy code. So that's what we're going to do. Next, let's go look up our codes. All right. O09.5 category. This is supervision of elderly primigravida and multigravida. We already established that this patient was primigravida because this is her first pregnancy. So her codes are going to likely come from O09.51, supervision of elderly primigravida. And we're not going to code from O09.52, supervision of elderly multigravida, because this is her first pregnancy. So we're going to eliminate O09.52 category, specifically C, O09.521. And that leaves us with B and D. And O09.511 is correct. This is elderly, supervision of elderly primigravida first trimester. We know that's correct. And we know the trimester is Z3A.13. But the difference between B and D are D is coding for this Z43.01. And this is the code for encounter for supervision of normal pregnancy, right? Yeah. So normal pregnancy is never a high risk pregnancy. So they're never coded together. You can't have a normal pregnancy and a high risk pregnancy in the same encounter. So Z34.01 is incorrect. And even in the excludes one notes, it says, hey, you cannot use this code for encounter for supervision of high-risk pregnancies. So Z34.01, encounter for supervision of normal first pregnancy, is incorrect. So D is coding for it, and it's got to go. And your answer is B. How many of you feel comfortable right now with identifying Z3A.13 as weeks gestation, 13 weeks gestation? Good. Some people say, yeah. Okay, so no one really said how they're answering the questions really rapidly. They didn't just answer this one rapidly, but a few of them, and I'm guessing they have a command of the guidelines. Yeah. Do you have your MCG manuals? All right, so this is your week's gestation. We're doing our due diligence. Z3A.13, this is the code for 13 weeks gestation of pregnancy. All right, so that one of the persons said, yeah, they are looking at their guidelines and they do have their MCG manual. I'm just letting you know they are answering in rapid fire time. Outstanding. And this is the first time they're in this class, so I just want to share that with your peers. All right, we got another scenario, exercise 5. Okay, Miss Stephanie, please and thank you.
A, B37.0, Z21, Z3A.13, B 098.711, B20, B37.0, Z3A.13, C 098.711, Z21, B37.0, Z3A.13, D B37.0, B20, Z3A.13. Megan, who is 13 weeks pregnant with asymptomatic HIV, presents to the ED with elevated temperature, stomach pains, and unusual spots on her tongue. After examination, the ED physician diagnoses Megan with oral thrush. Carter, your time begins now.
Okay, coders. I'm going to stop right here. I think the class, let's see. All right. Outstanding job, everyone. All right. So here are the key words. We have 13 weeks pregnant, asymptomatic HIV, and she's here in the ED with elevated temperature. She's got some stomach pains, unusual spots on her tongue, and after examination, she's been determined to have oral thrush. So I'm documenting everything, and it says she has HIV, asymptomatic HIV, but I'm questioning that because HIV, asymptomatic HIV, means without symptoms. So coders, do you think this patient is showing some HIV-related symptoms? Yeah, yeah, she is. And we're going to show you how we know. She's got some stomach pains and some temperature, and she's been diagnosed with oral thrush. I'm going to go to the HIV and pregnancy. And it says that this patient, if they have symptoms in pregnancy, then they are no longer asymptomatic. Now, in chapter 1, we listed in the pregnancy HIV, not pregnancy, but the HIV complications, we listed the complications. And if you can recall, Oral thrush was a listed complication. So if you go back to chapter 1, you'll see that oral thrush is an HIV complication. So this patient is no longer asymptomatic without symptoms. So we are definitely going to sequence B20 instead of Z21. So A is sequencing for Z21. Oh, wait. D is wrong. It's wrong because it's not sequencing your chapter 15 code first. So I kind of got a little ahead of myself. It's telling you to sequence first your O code, 098.7. Guidelines say whenever you have a chapter 15 diagnosis, they must go first. 9 times out of 10, your chapter 15 codes will be sequenced first. So if you look at A and D, excuse me, they're sequencing this B3 7.0, this infectious diseases, the thrush code first. So that's going to be wrong. Also, anything sequencing Z21, those symptoms, that's going to be wrong too. And you know what? You can deduce just based on these guidelines and the sequencing order that B is our answer. And here are your HIV related conditions from chapter 1. If you go right here where it says common HIV related conditions, you'll see your Kaposi sarcoma, lymphoma, etc. Thrush is the last one. So we're going to get rid of Z21. Look at this. We have a sequencing guru in this class. He said, and B20 is out of sequence. It is. It is. Yep, at D, it's out of sequence. All right, so this oral thrush is an HIV-related condition. Z21 is incorrect because it's coding for symptoms. And B is your answer. Let's do our due diligence. 098.7 is HIV disease complicating pregnancy, and underneath it tells you how to sequence it. Yeah, I'm loving these instructional notes. So 098.71, you're going to sequence first, and this is for the first trimester. And then these instructional notes say use an additional code for your HIV related, your HIV, and B20 is next. There you go. And then if you go to B20, it's going to tell you what to do after that. It's going to say, hey, code first, your pregnancy complication, then use additional codes to identify all manifestations or your HIV-related condition. So if you go to B20, it says sequence your O code first, then it tells you to sequence additionally or after any and all manifestations of HIV or HIV-related conditions. And that's your thrush, B3 7.0. And then we're going to sequence last our weeks gestation. We know that 13 weeks gestation is Z3A.13. And if you said B, outstanding. Now I want to kind of speed things up just a bit, and I want to take you to a quick discussion on coding for deliveries. Just ICD-10-CM coding for deliveries. All right.
Thanks for tuning in, and until next time, happy coding!